stay engaged. Have people around you who uplift you, who are happy with you, who are joyous with you, who exercise with you, who eat with you. Maintain your community.
Welcome to Living Real Change, a podcast from Piedmont Healthcare. I'm your host, Dr. Lacey Knight, Chief Health Information Officer here at Piedmont. Join us as we highlight the people, the stories, and ideas that are transforming care and strengthening communities across Georgia. From inspiring patient journeys to expert health advice, each episode offers insight, hope, and a closer look at what real change looks like in healthcare today. Taking control of your health can make all the difference at any stage of life. Dr. Belinda Brown-Saddler, a primary care physician, discusses what we can all do to take a more proactive approach to our health. She emphasizes that it's never too late to start building healthier habits and shares practical tips to help make that change. From nutrition and exercise to staying up to date on vaccines and annual checkups, she explains how small, consistent habits form the foundation of long-term well-being. She also breaks down how to stay healthy across every stage of life, with simple, actionable ways to maintain these routines, even with a busy lifestyle. So I'm looking forward to talking to you today. Thank you for the time.
Thank you for having me.
I don't want to take for granted that everybody knows how physicians think about the term prevention. And I want to just give you an opportunity to answer the question, what is prevention, or how do you think about prevention as it applies to either medical conditions or overall health and wellness?
Well, I think that everyone should have a primary care physician, first of all. And I believe that everyone should get an annual checkup. So that entails having your doctor do a full, complete exam and lab work as well. And some of the preventative measures include also getting vaccinations in a timely manner. So a lot of times we'll have our parents take us to the pediatricians when we're young, or to family medicine physicians, because we do see children as well. But usually after that, once they hit, college age and beyond, they kind of forget. So I recommend that starting at, as an adult, a young adult around 21, when you're done with your, baby doctor or child doctor, that you should take on the initiative to schedule an appointment to have your annual physical. And you should continue with that throughout your lifetime, because preventative measures are what help to keep us healthier longer and help us to, if we have any conditions, we can detect them sooner. So definitely prevention is key.
That's great insight. I'm curious, how are you framing a conversation with somebody who's 20 and is maybe not really thinking long-term yet, in a way that resonates with them or creates value from these types of conversations over the years of that decade?
Sure. Well, definitely I let them know. I use myself as an example. And being that I'm a mother of some young people in their 20s,
Mm-hmm.
I let them know that, once as you age, your muscle mass decreases, your stability with walking decreases. You may become a little more frail as we age. So I stress the importance of exercise, of maintaining their muscle mass by doing some type of resistance training. I also stress the importance of heart health, because as we age, our heart is a muscle, just like any other part of our body, any other muscle, and that we need to also exercise our heart with cardio exercise. So I stress, doing something that they may enjoy, such as running, swimming, dancing, any type of cardio work. And of course, they will have to like it in order to maintain it. And it is important to maintain it because it is a lifestyle. So once this 20-year-old person gets to my age, then they will still continue to exercise and do that cardio workout and that resistance workout with either weights or resistance bands or even calisthenics, because it will benefit them in the long run.
So that the 20s are really, you're helping guide them into really what it means to be a healthy adult, and how to kind of start to understand the types of things that they need to think about or get engaged in, and figure out how to fit it into their life.
Yes.
How does that change when they get into their 30s and 40s? What's
Yes.
different about those tiers?
A lot of times when you get into the 30s and 40s, you have more responsibility because it's not just you. You usually have, some people may have children by that
Hmm.
time. Some people also may have, 30s and 40s. Their parents are getting a little bit older, so they may have to help them a little bit more. So it's very important to carve out that time. And I tell people it generally takes only 30 minutes. If you can spend 30 minutes a day, every day, doing something where you disconnect from everyone and you focus on yourself, whether it's a walk to clear your mind, because that's still exercise, walking is still exercise, or if you go to the gym, or if you're at home, or if you're watching a video where they're doing exercise, as long as you take that time out to do it and just make it part of your daily habit. Just like you brush your teeth, you exercise, some type of exercise, 30 minutes a day. And it helps not only with your body, but with your mind. Because really, exercise is just as important for your mind as it is for your body. The stress
Sure.
level, it helps tremendously.
So what types of preventative activities have we moved into? Because it sounds like in your 20s, you're getting the physical exam, you're developing a relationship, you've got maybe more flexibility to incorporate these great habits and lifestyle choices. And
Mm-hmm.
then 30s and 40s, I hear you that that's the years where your time to commit to your health gets a bit compressed. So you have to figure out how to preserve it,
Yes.
because you've got all these different competing priorities between family and maybe work and things like that. With those annual visits, what are the types of preventative things that you start to think are more important that people make sure that they're getting done?
Definitely the heart. We want to focus on the heart because as we get older, as we get into the 30s and 40s, I tend to see the cholesterol levels starting to increase. I see maybe the hemoglobin A1C screenings for diabetes start to increase. So I focus on, and of course, hypertension and high cholesterol and diabetes all affect the heart. So I work on, okay, we're starting to see some of those numbers start to increase. So we have to sometimes start with medication at that point. It's not uncommon to start in the 40s on high blood pressure medication or cholesterol medication or even medication for diabetes. But definitely, I still stress the fact that you have to take the time to eat right and exercise. And sometimes I know it's hard to perhaps cook a healthy meal every day. So I recommend meal prepping. If you can prep on the weekends, and a lot of times I tell my families to incorporate the family, have that as a family event, on Saturday or Sunday. Involve the children so that they can also start very young with developing healthy habits. So if you all cook together as a family and cook healthier meals, they see the vegetables, they slice up the vegetables, it makes them already get into the habit of, okay, yeah, this is healthy. This is the way I learned to eat, and this is the way I would eat throughout my lifetime. Another thing that I say for parents who are very busy is that they can exercise with the kids. A lot of times kids may have soccer or swimming or baseball or football. So that parents can also, while they're watching the kids out in the field, they can walk around the field. They can, walk around their track or whatever. So that way they are still getting in something. So a lot of times, once you're in your 30s or 40s, multitasking is real. So definitely, most people have to do some type of multitasking. And once they get in the habit of doing it, it becomes something that is regular for them. They are also being a role model for their children, and it's helping to develop healthier lifestyles. It's helping if they do have chronic conditions to help to control them, such as, blood pressure, diabetes, and sugar. It helps to better control those chronic conditions as well with those lifestyles.
This is sounding a lot like lived experience that
Yes.
these are things you've also kind of figured out how to do for yourself. Is that
Yes.
right?
I practice what I preach.
That's awesome. So We've talked a little bit about early 30s and early 40s, getting further into the 40s and 50s. When do you start to have discussions around cancer prevention in addition to heart disease and other type of metabolic diseases that you've referenced, like diabetes and things like that?
Sure. Well, cancer tends to increase significantly starting in your 50s. 50s and up, the cancer diagnosis is far more common. Actually, between 50 and 66, I believe it is when many people are diagnosed with cancers. So definitely the screenings, the colonoscopies screenings actually start now at 45
Mm-hmm.
because right it used to be at 50 and they've decreased it to 45. As far as mammograms, women should start getting their mammograms at 40. And if they have a strong family history, of course, they may need additional measures, but definitely get that mammogram. As far as for men, African American men, we start screening for prostate cancer around 45. We start a little bit earlier because it tends to be a little bit more aggressive when it's finally detected. So we tend to do a little earlier with the screening. And the PSA now is more of discussion that we have with our patients. So we find out if they have a family history, if they're having any urinary symptoms or anything like that. So it's more of a discussion with the gentleman as far as that goes. The other thing is also for gentlemen, testicular cancer. So do a testicular test. That tends to affect younger men, actually.
Mm-hmm.
Testicular cancer more in the 20s to 40 range. So we do a testicular exam as well. The other screening exam is for cancer. I would say lung cancer. That's a little bit older, but it starts at 50 as well. Okay. So if a person is a smoker and if they have smoked, like have a 20-pack history of smoking and they are 50 years old and still smoking, then we do a low dose CT scan of their lung.
Mm-hmm.
And if they have stopped smoking less than 15 years prior, we still do a low dose lung cancer screen for them. So 50s and above, we start doing more of the cancer screenings for patients.
You mentioned a few things I want to dive into a little bit further. I think the first part is that you've kind of laid out different types of activities and priorities and testing through different decades of life. But then you've also mentioned this really important nuance, which is capturing the individual risk factors and family history that influences how you decide which screening you get. So that's maybe something that's why that's so important to develop that early relationship and start to have those annual physicals, annual conversations with your physician. Because what might be true for one person in terms of when their screening needs to occur might be different for someone else based on how the history that is shared and some individualized risk factors.
Absolutely. Absolutely. So the two most common causes for cancer are lifestyle and environment. So lifestyle, a lot of that includes those who may consume a bit more alcohol and those who smoke. So those are the two lifestyle factors. Another lifestyle factor that increases your risk for cancer is obesity. Obesity actually increases your risk for cancer as well. So those are the main things, lifestyle and environment. If you're in an environment where there is, a lot of factories around or so forth, the polluted air, the polluted water, of course, that affects you. But then on the other hand, there is the family history. So I like to go through the lineage and find out, okay, what on your mother's side, on your father's side, what is prevalent, whether it is a certain cancer, whether it's early heart disease, strokes. And so I ask about all of that as well, because that's important to know. That may place a person at a higher risk for developing that condition as well.
At Piedmont, quality care changes lives. Meet Tom, a lifelong medic who suddenly suffered a stroke at home. Tom was diagnosed, treated, and in surgery within minutes, thanks to seamless coordination across the entire care team.
I've seen firsthand how every second counts. When I needed help, Piedmont moved with speed and precision, and that saved my life. A week later, I was back at home with my family, back to work and back to living.
Hear more at piedmont.org/quality care. Piedmont, real change lives here.
For those that start to see you or another primary care doctor in their 20s, they figured out the exercise, they figure out the diet, they figure out the other kind of healthy habits, compared to someone that totally blows off any type of preventative care until later in life. What age would you typically see a difference in either overall health based on the person that kind of starts early with the preventative care and the longer term view versus someone that joins late? So that's kind of the first part of the question. And then maybe the second part is that for someone that even starts late, so they didn't really take on any of these healthy habits until after they've had a diagnosis, maybe in their 40s or early 50s, how does adopting those later in life impact those conditions?
Well, I can tell you, I start seeing a difference between those who have lived a healthier lifestyle starting from their 20s versus those who have not, starting actually in the 40s.
Okay, wow.
Yeah, even that young, because I am seeing patients in their 40s with cancer, patients in their 40s with diabetes, patients with high blood pressure, patients in their 40s with high cholesterol. So I start seeing it in their 40s. But it's never too late, I tell people. It's never too late, okay?
That's great.
Because we do have, an advancement, of course, in medicine. So we do have a lot of medicine to help with weight loss for those who are obese. We also have, the medications for the high cholesterol, which are very effective that we have now. And we also have medication for diabetes, which is very effective. So we have advances in medicine to help. But also, as far as lifestyle, I tell them it's never too late. Even if you start off very slowly, if you start off with just a walk, a 15-minute walk a day, and move up gradually, is not too late. I have patients who are in their 80s who have exercised since they were, of course, young, much younger, and they can walk 4 miles a day, and they're in their 80s, and it's
amazing.
It's amazing. I say, I hope to be able to do that. So yes, it is absolutely. I have several people in their 80s who do that daily, and they love it. I have one who's 86 who just started taking up tap dancing. So once
That's amazing. That's fantastic.
That's fantastic. So once you have in your being that, okay, I'm going to keep active, I'm going to learn something new, this is part of my life, then your life will be lived much healthier and much longer. And the key is healthier. So it's not just longevity, but how you are living.
That's right. So you touched on 70s and 80s, which I think usher in some other concepts that relate to this. So the mobility piece you talked about, anything that you can highlight about preventing dementia, I think would be of interest. And then both of those things together really contribute to being able to live independently or act independently, I think, when you get into your late 70s, 80s, and beyond. So any insight into kind of how you guide people to take the steps necessary to improve chances of being able to retain mobility, independence, and brain or cognitive function as we age?
Sure. Well, I definitely think that it's very important that patients in their 60s, 70s, and 80s stay connected. Stay connected with family, stay connected with friends, because keeping engaged is what helps. It helps with your mental stability, it helps with your memory, it helps with your cognition. Just the fact that you are constantly talking with people and engaging with others, solving problems with others, so it's important to stay engaged. So that is one thing. The other thing is staying active. Just keep moving. Even if you have, certain conditions that may limit your mobility, as long as you can perhaps have maybe one person, like a trainer or a group class that you can participate in to help to keep you moving. There are several chair exercises, and I am really good with sharing that with my older population because chair exercises are actually a little bit challenging, and they can be quite challenging. So for those who have, arthritis and maybe aren't able to be as mobile, engage in a class with chair exercises. That helps. But definitely having a community, being in a community, not being isolated or siloed, but having people around you, eating with others, it helps. As long as you are engaged in a community, that helps with longevity.
One other topic that's been getting, I think, a lot more interest is sleep.
Yes.
So wondering if you could maybe talk a little bit about that and when you maybe begin conversations with
Yes.
with people around focusing on sleep.
Yes. Well, I started talking about sleep in the 20s, okay? Because a lot of times people in their 20s like to stay up later and,
Mhm.
and sleep they don't feel that is as important, but it is
Sure.
extremely important. I stress to them that you should get at least 8 hours of sleep, okay, as a young person. As far as with patients who are in their 40s, 50s, going through perimenopause and menopause, yes, sleep is a definite factor that I discuss because many women have the hot flashes, they have the night sweats that disrupts their sleep. When you don't get enough sleep, you have a hard time focusing the next day, you're irritable, you may tend to eat more because you want more carbs to fuel you because you are tired, and that leads to weight gain. So sleep is extremely important.
So, how would you like to leave our audience with some final thoughts?
One, stay engaged. Always have a community around you. It takes a village, just like it takes a village to raise a child, it takes a village to maintain an adult. Okay, so stay engaged. Have people around you who uplift you, who are happy with you, who are joyous with you, who exercise with you, who eat with you. Maintain your community. That's one. And number two, stay active. No matter what, stay active. Even if you have limitations, find a way to stay active. Be creative. So as long as you keep moving, you keep living.
Thank you for listening to Living Real Change. To hear more stories from across Piedmont Healthcare, be sure to subscribe and watch for upcoming episodes. For additional health tips, news, and resources, visit us at piedmont.org/living-real-change.